All right, today we're going to dive into a pretty rare form of thyroid cancer called medullary thyroid carcinoma, or MTC for short. We're going to walk through the latest expert guidelines from the American Thyroid Association and really break down what it all means, what a diagnosis looks like, and what the path forward is.
But first, let me ask you something. What if a single gene in your DNA could do more than just explain why you have a certain cancer? What if it could also predict how aggressive it's going to be and even tell you if your family is at risk? For MTC, this isn't science fiction. It's the day-to-day reality of how this disease is diagnosed and treated.
So, to really get why genetics are such a huge deal here, we first have to understand that MTC is, well, it's not like the other, more common thyroid cancers you might have heard of.
You see, most thyroid cancers, like papillary cancer, they come from what are called follicular cells. Those are the ones that make thyroid hormone. But MTC is a whole different ballgame. It starts in a totally separate group of cells, called C cells, and their main job is to produce a hormone called calcitonin, which, as you'll see, becomes a really critical blood marker for this specific cancer.
And when I say it's rare, I mean it's really rare. MTC only accounts for about 1 to 2% of all thyroid cancers in the United States. And that rarity is exactly why having these specialized expert guidelines is so absolutely vital.
Okay, so let's get right to the heart of it. The second someone is diagnosed with MTC, they're standing at a genetic crossroads, and the path they go down from here will determine pretty much everything that comes next.
There are basically two ways this cancer can happen. The first is sporadic MTC, which means it just kind of pops up by chance, completely random, with no family connection at all. But the second type, hereditary MTC, well, that one is passed down through generations, and it's all driven by one specific genetic mutation. And this brings us to one single, incredibly powerful gene, the RET proto-oncogene. The best way to think of it is like the master instruction manual for certain cells. But what happens when there's a typo in that manual? A mutation? Well, it can cause those C cells to just grow out of control. And this is how central this one gene is. A mutation in RET is the cause of pretty much every single case of hereditary MTC.
So this is the crucial point, and it's actually recommendation 6 in the official guidelines. Every single patient diagnosed with MTC should get a genetic test. It's a simple blood test, and it's looking for what's called a germline RET mutation. That just means a mutation you were born with. This one test is the fork in the road. It tells you and your doctors if this cancer was just a random event or if there's a hereditary link that you and your family need to know about.
And here's where it gets amazing. If that test comes back positive for a hereditary mutation, that specific genetic typo doesn't just tell you why. It actually provides a map, a roadmap that helps predict how the cancer is going to behave in the future. It literally breaks it down into clear risk categories.
So what the ATA guidelines did was take a system that used to be kind of complicated and they simplified it into 3 very clear risk categories, all based on the exact RET mutation someone has. As you can see right here in this table, they link a specific genetic code directly to a risk level. For example, if you look at the highest risk tier, which they call HST, it's associated with a specific syndrome called MEN2B. The high-risk tier, or H, is linked to a different set of mutations. And then most other RET mutations fall into that moderate or MOD category.
So what do these risk levels actually mean for a person? Well, the HST category is linked to a very, very aggressive form of MTC that can show up in the first year of life. The H category is also aggressive, and it often develops in early childhood, usually before age 5. And then the MOD category, that's a less aggressive cancer that might not pop up until later in childhood or even adulthood. This genetic map lets doctors be proactive instead of reactive. It's a complete game changer.
And that leads us straight to the treatment plan. Because thanks to all this genetic knowledge, treatment can often start before the cancer even gets a chance to become a real threat.
If you look at the official management plan from the guidelines, the first steps after an MTC diagnosis are crystal clear. First up, that RET genetic test to figure out if it's sporadic or hereditary. At the same time, doctors are going to measure those key blood markers, calcitonin and CEA. And they'll do a neck ultrasound to get a good look at the thyroid and the lymph nodes around it. And of course, if that RET test comes back positive, they immediately start screening for other related tumors that can be caused by the very same mutation.
Now, this proactive approach is most powerful in kids who inherit a RET mutation. And based on their genetic risk level, the guidelines actually recommend a prophylactic thyroidectomy. That means removing the thyroid before a dangerous cancer can even develop.
For kids in the highest risk group, this surgery is recommended within their very first year of life. For the high-risk group, the goal is at or before age 5. And for the moderate-risk group, the timing is a bit more flexible and it's guided by those calcitonin blood levels.
And I really want to drive this point home. This isn't just about treatment, it's about prevention. The entire goal of knowing this generic information so early is to step in and remove the at-risk organ before an aggressive cancer can take hold or spread. I mean, that is a profound shift in how we can approach hereditary cancer.
But you know, the implications of a hereditary diagnosis, they don't stop with the individual patient. This knowledge carries a unique kind of responsibility that actually extends to the entire family.
The guidelines actually discuss this legal and ethical idea known as the duty to warn. What that means is that finding a hereditary, high-risk cancer gene in one person creates a responsibility to make sure that their relatives, who might carry that exact same gene, are aware of their own risk.
So what does this actually mean for you? It means your genetic information is also your family's information. A positive RET test means your parents, your siblings, and your children all have a 50-50 shot of carrying the exact same mutation. The guidelines are really clear that they should all be offered genetic counseling and testing. Now, this isn't to scare them. It's to empower them with the same knowledge, to give them the same chance for monitoring and for preventative action. It could literally save their lives. And there are even options for prenatal testing for those who are planning to start a family.
So it all comes full circle. Medullary thyroid carcinoma is unique because it's a cancer where your genes can give you a clear map. A map that predicts risk, guides preventative surgery, and can extend a lifeline to your family members. It really leaves us with one final thought to chew on. If your genes held a map to your family's future health, would you share it?